Hello, everyone, and welcome to the Friday, March 5th, 2021 edition of On Iowa Politics. This week on the podcast, we discuss the upcoming one-year anniversary of the COVID-19 pandemic in Iowa and Chuck Grassley's questioning during a hearing on the January 6th attacks on the U.S. Capitol. Hello, everyone. I'm Erin Murphy, the Des Moines Bureau Chief for Lee Enterprises. With me this week are Amie Rivers of the Waterloo-Cedar Courier. Good morning, Amie.
Good morning, Erin.
And also Gazette columnist Todd Dorman. Good morning, Todd.
Good morning.
As a reminder, you can subscribe to the On Iowa Politics podcast on iTunes, Spotify, Stitcher, or wherever you find your favorite podcasts. First up this week, this coming Monday marks the one-year anniversary of the first confirmed cases of COVID-19 in Iowa. Everybody remember that ship that came back from an Egyptian cruise? Seems like more.
Yep, because there was a Cedar Falls woman on that
one.
Oh,
there you go. There you go.
Oh, no, never mind. That was the one that was in California. I'm getting my ships mixed up. That's how it
was.
There were a lot of infected ships.
It seems more like a decade ago than a year ago sometimes. But anyway, since then, the pandemic has claimed the lives of more than 5,500 Iowans and caused more than 360,000 infections. And by the way, we want to encourage everybody starting Sunday to pay especially close attention to your local Gazette or Lee newspaper. Journalists from those papers are working together on a special project to note the one-year mark of the pandemic in Iowa. It will be a series of stories and online content that will begin publishing Sunday and run daily through the following weekend. And I can promise you it will be well worth your time and attention. Amie, you're working on a couple of stories for this project, so let's talk a little bit about each of those. Wanted to start with the so-called COVID long haulers, those folks who just can't seem to shake the virus once they become infected. And you'd actually done some previous reporting on this too. So tell us what you learned about these folks.
Yeah, we started hearing about people that had been going through so-called long COVID. And so I finally decided to start reaching out to some of these people just to see what they were going through. And their symptoms, like, they run the gamut. I mean, they're the normal COVID symptoms that you would sort of expect maybe would be hanging on a little bit, like a cough, a chronic cough, shortness of breath. You're not able to really do a lot unless you have a whole day to lay down type of thing. But also very unexplained things. Obviously, we all heard about the loss of taste and smell, which turns out to be kind of possibly a neurological condition. But they were also getting other sorts of conditions that maybe pointed to that the immune system was misfiring or the virus had gotten past the blood-brain barrier. Things like lesions on the skin or just joint pain. Brain fog is a lot of what people were talking about, where they would just have days where they couldn't do basic math. They couldn't remember that word, very sort of like early dementia syndrome that was happening. And really they were going to their doctors and their doctors were saying, we still don't know what's going on. This is so new. We don't even barely know how to treat regular COVID. We're just learning about that. We certainly don't know what this is. But doctors are saying, this is real. I talked to a physician down at the University of Iowa Respiratory Health Clinic, which they set up specifically for these people. And they're just sort of, they're asking if they obviously want to be part of a research study, but they're treating them regardless, just to try to get a handle on what is this, what exactly is happening to people. And they are starting to find patterns. And doctors are saying, this isn't just people, that are weenies that are faking it. These people have a real thing that's still occurring, and it's occurring in a large enough percentage of the population that it could seriously be a health issue for years to come.
And when we say long haulers, and forgive me if you said this and I missed it, how long, or what are some examples you heard of how long people have been dealing with these ongoing symptoms?
Some people said that they would have symptoms for a few weeks or months afterwards, but there were people that I talked to that had gotten it back in May and were still dealing with symptoms that would come and go, seemingly at random.
Wow, amazing. So that's one for folks to watch out for. Amie, another story you're working on, we'll talk about how nursing homes and other long-term care facilities were just devastated by this pandemic. That one's not running until a little later in the series, so I don't know how much you've groundwork you got to work off of yet, but I regardless, I know it's something you're familiar with. What do you expect readers to be able to hear about in that story?
I actually got off the phone. I was talking with a couple of administrators yesterday just to try to get a handle on, what all they went through, because we're doing this for a lot of industries, like you mentioned, but nursing homes were really sort of the petri dish. We did not want to get COVID-19 into nursing homes. That was the deadliest place that we could get it in. And we saw that happen when it did get into places and it was allowed to run rampant. There were hugely bad outcomes. And when people say bad outcomes, it means that people were getting sick and people were dying. People obviously in these places are generally older. They generally have more medical conditions. They're one of the most highest risk populations. But in addition to that, you can't just lock them down, right? You've also really got to have an employee base that takes it very seriously. And a lot of these nursing homes did have that. I mean, people go to work and it's their job, but they also really care about people that they work with. And a lot of them, when they realized that they were maybe an asymptomatic carrier, were just devastated to learn about that and knew that they were working at that time. So it was a really tough thing, I think, on a lot of people, but especially for residents, for employees, and also for family, that wasn't allowed to visit. And even now, there's still a few restrictions in place, but places like Western Home and Cedar Falls have said, we are starting to allow more visitors again. They were able to get the vaccine first, and a lot of people were vaccinated. And now that a lot of these people's family members who might be over 65 as well are also getting vaccinated, that's also helping them to be able to ease these restrictions, because the mental health of the residents too. I mean, one administrator told me yesterday, some of these residents would rather not go on living than not see their family. It was just a really tough situation all around for them.
Yep. That's such a great point. And that was early in this. That was one of the most common questions I would hear would be, when are families going to be able to see their loved ones at nursing homes again? It was so tough either way. And then you have to try and balance that with kind of what you described, a petri dish. I mean, you take what we know about the virus now, something that spreads rapidly, especially indoors, and the most vulnerable people are older people. I mean, that's a nursing home described to a T.
They were talking about silver linings too, and it's tough to find, but one of the silver linings is really just not only looking at your employees is like so valuable. I mean, and probably worthy of more than they're being paid currently, worthy of more resources to help them, but also just like in the ways that we've expanded telehealth. And hospitals were talking about this too, just that they were just trying to get telehealth operational, but everything from legislation at state and federal level to insurance providers to just adoption by providers themselves and patients was just really limiting it. And now it's exploded. I mean, you saw hospitals and nursing homes just like overnight set up these systems where they were able to get virtual visits, not only from family, but virtual visits from doctors. And that they think is really going to be pushed forward in the future.
All right. And Amie, before we move on from you, I want to ask you about one more story that your paper, I know, is working on, the Waterloo-Cedar Falls Courier. And you mentioned talking about other businesses and industries that we're exploring here that were devastated by the pandemic. The other big one, obviously, food processing plants. I know you've done a lot of reporting on that issue over the past year, just kind of for maybe people who didn't follow it as closely back then, or maybe have forgotten, because this happened early on in the pandemic. I mean, we're talking, late spring, early summer last year. Just how bad did it get for some of these plants? You've got a Tyson plant.
It did get bad. There were out of, over 2,000 workers, over 1,000 of them at one point last spring had already had coronavirus. And this was of May. So it just ran rampant in there for probably a number of reasons. People in those settings have to work very closely together. They have, congregate break settings. And even just like Tyson themselves was saying, even when they go home, they might live in congregate settings, that have a lot more people in a residence than we would, normally think of in a residence. It was just sort of this ticking time bomb, and then it went off. And of course, people died, at least 6, just directly from Tyson workers. And so it was really important, I think, to see them finally get the vaccine, which they were able to do starting this weekend, I think a little bit last week. So So that was really good to finally see that the manufacturing workers that have really just literally put their lives on the line have finally been able to get vaccinated, because it's been a long, long, tough road for them.
Yeah, especially for those types of people that we just talked about. Like you said, it's a ray of hope for all of us, but especially for those folks. Todd, let's bring you in now. I'm going to start out really open ended here. We're 1 year into this thing. What has struck you most about uh, what we've learned about and what we've experienced over this past year of this pandemic?
Well, I've been struck a lot because my glasses are fogged up a lot. I wear a mask. I'm running into things. That's a fairly
You gotta get
minor.
the nose piece right. I
Yeah,
know that
yeah,
struggle.
yeah. So it's a fairly minor problem, but I thought I'd bring it up because I know it's scientists are looking for a cure. Uh, I think and this is kind of alludes to what Amie was talking about. I think what struck me the most is just how the pandemic sort of, really showed us, in stark terms, some of the problems that we sort of suspected we had and that people were sort of working on. But then this happened. And I'm thinking of, workers that don't have sick leave and, the meat packing plants. I mean, we've left basically regulations to the companies. Congress has been willing over the years to speed up the lines and to, to move them closer together and make the work more difficult. And then when the pandemic happened, I mean, our state government didn't, trusted the companies, and it turned out the companies weren't, performing at an optimal level on keeping their workers safe. Nursing homes, we've seen a reduction in oversight and regulation over the last couple of decades, and I think that came back to bite us when we needed to do more to keep nursing home residents safe. And the food system that we've talked about before, that you've got a small number of companies that control these packing plants, and so if you lose one packing plant to illness, it causes a collapse that forces farmers to euthanize hogs, and it causes
Right.
shortages of meat. And so, I mean, there are just all of these lessons that we've learned that we suspected there were problems, and people have been saying there are problems and warning us about these problems. And then this happened. I think that's one of the disappointing things about, the legislative session going on, is that they're not really addressing a lot of that stuff. They're sort of sticking to the status
Mm.
quo. And I think there's a lot of opportunities that we could have taken to look at what happened and fix some of that stuff. But uh, yeah,
Yeah, that was going to be my follow up question to you. There is you list things that's good that we've ID'd all those things, but have we come up with any solutions for any of those?
yeah. Well, I think there are some moves at the federal level to, look at workplace safety in meatpacking plants. Um, and there, but a lot of this is state level regulation. I mean, we're the closest to these uh, to these facilities, and yeah, there just doesn't seem to be a lot of appetite. I mean, the industries that own these facilities have been cultivating political influence for decades. They've given lots of money to candidates. When bills are being written, they have legislators and governors' ears to tell them what they want in them. So that's going to be a tough infrastructure of influence to sort of break. And if a pandemic can't do it, then I'm not sure it can be broken.
Yeah. Todd, I wanted to ask you as well about the state's response to the pandemic. Governor Kim Reynolds and the state public health department. Just as kind of in the way of a quick synopsis of the highlights, the governor closed schools and many businesses early on, but she resisted a shelter at home order, which some other states did. And there's differing opinions on whether those were a good idea in the long run. Governor Reynolds also resisted a face mask requirement until November, when cases, hospitalizations, and deaths finally surged. You look at the data for the course of the pandemic, Iowa has the 16th highest per capita COVID death rate. Um,
Mm.
but on the other hand, the state's finances and economy overall have not been badly damaged. So I guess what you consider more important. Todd, how would you rate the states and the governor's pandemic response?
Well, I think when I look back on it, I think it sort of is encapsulated in one period in the fall where, I mean, we had seen a spike in cases at campuses, on university campuses, and she closed some bars in certain counties. Well, then in October, she opened them back up. And about that time, she, began traveling the state, campaigning for President Trump and for other Republicans at a lot of events where she was maskless. There was a Trump rally that was, most of the people there were maskless. So they were kind of shunning the public health advice, out there politicking. And during that month of October, there were clear signs that something bad was happening. Hospitalizations began to rise, case numbers began to rise. You could tell that this sort of potential spike was coming, and they didn't do anything. They held almost no press conferences to answer questions about it. And then in November, it blew up, and hundreds of people died during that spike, if not thousands. So, I mean, it just seemed like a lot of what her motivations were not public health driven. They were sort of politically driven. And I think the fact that she was campaigning during this month when maybe we could have at least, if not headed off the spike, at least maybe blunted its sharp ascent, we didn't do it. And we announced a sort of an odd Swiss cheese mask mandate after, I mean, after hospitalizations had, jumped over, I think over 1,000, there were more than 1,000 people hospitalized. I forget how high that actually got, but it was, yeah. So, yeah, it was a very Trump-like response. You sort of tried to keep businesses going and tried to, uh, sort of send the message that we've got to live with this. It's not that big a deal. But, instead of doing the things that we might have been able to do to control the spread better. And yeah, we're seeing that now. She's pulled back all public health measures that were in place, the Swiss cheese mask mandate and social distancing and group limits. So hopefully this will work out, which is kind of what we were saying during the whole pandemic. Well, I mean, I hope she's right. And again and again, it turned out she wasn't. But yeah, with vaccinations increasing in Johnson and Johnson out there, I'm optimistic. But yeah, I don't think this was an example of super competent state government.
So to fill in the blank there, at its peak, we had more than 1,500 Iowa people hospitalized for a stretch of a few days there. And you're right, Todd Boy. I was at that Trump rally. As I was putting together some of the work for this project, and one of the things I was working on was a timeline and going back and the big headlines throughout the course of the pandemic, and I was able then, as I collected those things, to reflect back on when in the middle of it, you don't have the same view as the benefit of being able to step back now and look back, and boy, to think about that Trump rally and all the people that were there and very few wearing masks, and to know now what was going on. And we, like you said, it's not like we didn't know at the time. There was a pretty good sense of what was going on, but now we know for sure how bad things were starting to get at that point. And to think of that event now, it's chilling and upsetting, really, and unfortunate.
I was going to say, how do you, Todd, how do you see the calculation to open it up to people under 65 now, with a variety of conditions, including a BMI of over 25, which doesn't seem like very high to me. And also, smokers and
that's my golden ticket. So
that's right. I mean, do you think that was what? That seems very broad to me.
Yeah, I think with the Johnson and Johnson shot, maybe they're feeling like they're going to get more vaccine and can spread it out that much. I think, what are we supposed to? I forget how many hundreds of thousands of doses we're supposed to be getting soon. And the governor took the Johnson and Johnson one, so that uh, people would see that it's a high quality product, because you've got you've got I've heard people say that people are saying, no, I want the good stuff. But then
Yeah.
I'm thinking that's not going to be a problem in Iowa. I mean, Busch Light is the most popular beer in this state, so I don't think vaccine light is going to be a real issue for people. They don't want the good stuff.
Well, and as they have pointed out, it does still prevent against
Oh
that
yeah,
serious hospital death.
yeah. It's
Maybe
like
you'll still
almost
get a cases.
yeah. It's almost 100% effective against death and hospitalization. I mean,
Right.
that's what you want to avoid.
That's
Yep, and that's what the state public health folks stressed both during that. I guess not during the press conference; it was afterwards. Um, Kelly Garcia, the state public health director, often comes out and kind of follows up with any questions reporters have, and she was very much stressing exactly what you guys just said, that don't get hung up on that 70% number. Um,
yeah.
what all of these vaccines are doing is keeping everybody out of the hospital, and keeping everybody out of the funeral. And
They
that's
mentioned that the flu vaccine is only about 70%
exactly,
effective,
exactly.
which I didn't even know, right?
Yeah.
So, I
Yep.
mean,
Yeah.
if you think about it that way,
Yep,
it's not
exactly,
too bad. Plus, it'll be a lot easier for rural hospitals and
exactly.
pharmacies to store. It doesn't have to be frozen.
Well, yep, and with the one shot, you don't have to make 2 appointments and have people
That's
travel
right.
however far they have to.
Right.
One more quick question on this topic. I'm curious to get both you guys' thoughts on this. Todd, we'll start with you. One of the things that people kind of talk about is how so much changed during the pandemic, and how many of those changes have maybe been for the good, and that will stick around even once we're out of the woods on this thing. So let me just, and it doesn't even have to be politics. The world is your oyster. Give me one thing that you think the pandemic changed or created that you think is part of our world now, even once we're done with this thing.
Am I first?
Yeah, sorry,
Yes.
Todd, you go ahead.
Oh, okay. Um, well, I mean, I think one thing is that people really learn to appreciate the state park system, the open spaces. I mean, I think going forward, when there's going to be choices to make investments in some of those outdoor spaces, I think people have really embraced. They'll be probably more likely to appreciate that. Uh, the other thing, and part of this, I don't know that they'll keep this in place. I like in the legislature that you can watch subcommittee meetings and proceedings online. I think that's something that they should try to keep going forward, because I think it allows a lot more people to see what's happening, which is maybe the last thing they want, but but they could at least give it a try.
I agree with that. And let me just add that I hope that they continue to do that, but that they also um, go back to relaxing and go back to the normal rules for the press, because I
Oh yeah,
appreciate what they're doing right now and moving us off of press row and into the gallery. I'm okay with that during a pandemic. It's just the reporter and me can't help but be nervous that that's going to be a permanent. And I hope that's not the case. And I don't want to imply anybody suggested that, because nobody has. We haven't had that conversation yet. Believe me, we will. I can assure you, as president of the Iowa Capitol Press Association, we will be having that conversation with legislative leaders. I hope that the folks are willing to go back to normal, and the press hasn't been permanently moved off of press row. Amie, how about you? What's the new normal from the pandemic that you see?
I'll agree with Todd on the opening up virtual sessions and go one step further. I love the way that city councils have also opened up to Zooms and virtual sessions. Keep in mind, this helps people that can't get out of their homes, are traveling, or have other reasons that they're not able to be on site for a city council meeting. And these are really, crucial meetings that deal with everything from the state of your roads to your taxes. And so definitely getting more people an option to go to these meetings if they can't physically go to these meetings, I think would be amazing to keep going
I was going to say, I think the DOT has already said that they're going to keep the system they have now, where you basically make an appointment to get your driver's license. I mean, it's just
forward.
really
Nice.
made things more efficient, and uh, you don't have to sit there and wait for your number to be called and all of those things. So I think they're probably going to keep that. which is good news.
Yes.
I mean, I love hanging out at the DMV as much as anyone, but yes.
Which is to say, not at all.
And restaurants may be keeping takeout,
Yes,
Well,
that'll
yeah,
be
order on the
interesting to me too. Yep.
I think
So
they
easy.
did. Didn't they passed a bill in June that you could still sell like drinks, right?
There you
Yep.
go.
To go.
What else do you need?
It's a brave new world, man.
The 16-ounce margarita bottle lives on.
All right. One quick non-COVID topic to cover this week. We wanted to talk about U.S. Senator Chuck Grassley. Iowa's longtime Republican senator this week participated in a hearing with the director of the FBI about the January 6th attacks on the U.S. Capitol. But in his opening comments in particular, and in his questions too, Senator Grassley seemed more interested in Antifa and the occasional riots last summer during social justice protests. Amie, tell us what Senator Grassley said during that hearing and then later told you and other Iowa reporters about all this.
Sure. And you've probably heard it from other Republicans too, that they're talking about making sure that we're not just focusing on, the Oath Keepers, the other white supremacist groups that FBI Director Christopher Wray was saying had been the ones that attacked the Capitol on January 6th. But he's saying, now let's make sure we're looking at everything, because obviously, as a Republican, he hears far right and hears that might only include Republicans. So he's thinking, all right, who else is up here? So he's talking about, so-called Antifa, so-called, left-wing, far left groups that you saw protesting this summer, obviously for social justice protests, but going into everything from, shutting down the city block in Seattle to vandalizing the courthouse in Portland, those sorts of things. So he really wanted to make sure that Director Wray was going to equally focus on both of these groups.
So Todd, let me ask you: should Americans be equally interested in left-wing violence at social justice protests as they should in right-wing violence at an insurrection and attempt to undermine our democracy? And as a side note, can I also ask, does that sound like a loaded question? Because if I'm being perfectly honest, it probably is.
Yeah, well, I mean, of course, nobody's condoning violence or vandalism. Those are already crimes and people are being prosecuted. But to sort of equate protests aimed at, solving a real problem, which is, systemic racism in our criminal justice system and in other parts of society, and guys who came to attack the Capitol because they believe the election was stolen because the president and so many others lied to them and fed them conspiracy theories. I don't think there's much comparison between those. You look back during the civil rights movement, you had politicians, Dwight Eisenhower, people like that say, well, there's a lot of extremism on both sides. I mean, you've got the NAACP and you've got the KKK, and what are we going to do with all this violence? Everybody has to just get along. Well, and you look back at that, and yeah, you think that's ridiculous. And we're going to look back at this and think it's ridiculous. I don't know why politicians continue to want to play it so that when we recount their careers someday, we say, yeah, that was really dumb. I mean, that made no sense. So I understand what they're doing. They're trying to provide political cover for the former president and the senators that helped out, gave an assist to the insurrection. But yeah, I don't think a lot of Americans buy this both sides are bad situation, because one side was, as I said, was basically acting on a big lie and some of them went into the Capitol, hoping to kill the vice president and other members of Congress. I don't think there's any comparison.
What about the political calculus for Grassley, seeing as they've been doing, CPAC surveys and post-election surveys that show a significant portion of Republicans still fully back Trump?
Yeah, if Chuck Grassley can't sort of run on his own merits after, the better part of 6 decades in elected office, I don't know. I mean, I can understand if you were a first-term senator and you were maybe we're thinking someone was going to, challenge you in a primary that was a real challenge and not, Jim Carlin. Sure. But I mean, it's Chuck Grassley. He should, at this point in his career, he should be able to do the right thing and not fear, electoral consequences. I mean, the only thing I can think of is that he really believes this, and which is unfortunate.
Yeah, I mean, and to that point, Todd, I mean, I can't imagine any Iowa Republican that's out there that can seriously challenge Chuck Grassley in a primary. So I'm not paid to be a political consultant. So maybe I can't see why it's important to say those kinds of things, but I don't see where there would be a political benefit. I see no reason for him to be afraid of people to the right of him in a primary. I guess that's what I'm trying to spit out here. Maybe he does feel like he needs to kind of protect against that flank. I don't know. Well, we'll watch that ongoing as this good senator, first of all, decides whether he's going to run or not, as we've talked about before, and I'm sure we will again on the podcast. But that's it for this week's edition of On Iowa Politics. Thank you, everyone, for listening. We hope it was worth your time. If you like the show, subscribe and tell a friend, and you can send fan mail to oniowapolitics@gmail.com. And don't forget, the work of everyone you heard today can be found on the pages and websites of the Quad City Times, Waterloo-Cedar Falls Courier, Sioux City Journal, Mason City Globe Gazette, Muscatine Journal, Council City Bluffs Daily Nonpareil, and Cedar Rapids Gazette. That thing is getting so long, I feel like I'm reading the side effects at the end of a drug commercial on TV. Yeah. We need someone to read one of those speed readers to read that part. Anyways, and don't forget, everyone, to watch for all those COVID-19 anniversary stories starting Sunday. Euforquestra will play us out this weekend. If you know a talented band or Iowa musician who should be featured on our show, send us a sound file. For Amie, Todd, and our producer, Steven, I'm Erin Murphy. Thanks, everyone, for listening.
locks her house up so tight to keep all the ladies out and to make that soup to taste so right. All the ladies, they drop by, they say hello in one big group. But my grandma knows that they talk big lies, they just want to know what's in that soup. And they said, "Ooh, what you put into that soup?" And they said, "Ooh, what you put into that soup?"